What would you say to somebody who just gets diagnosed with, especially cancer, and it's very scary, and what they should do? Because a lot of times a doctor will say, you know what, we caught it in time, you can start chemotherapy on Monday.
Right. My bias is to bring out all of the different forms of medicine that are going to be helpful, because cancer is a late-stage disease. You've actually gotten to the point of degeneration. So the analogy I use is to think about a keyboard, like a piano keyboard. And I think of drugs and surgery being the bass notes on the piano, food and herbs being the middle C, and then more energetic therapies such as homeopathy, acupuncture, qigong. They populate the upper notes on the piano. And when someone has a really late-stage disease, ideally they use the whole spectrum, the whole keyboard. And each person has a home base note. Like if you've ever been around a piano or played piano, if you hit certain notes, certain things in the room start to vibrate. I think of that being true for our particular bodies. We have a home base on that keyboard, and ideally that home base area is utilized to help better tolerate the other therapies. So I tend to work, because of the therapies I choose, I tend to work with people who are from middle C up. That tends to be, for me, home base, and therefore often the patients I work with. So I encourage people to continue to use those home-based therapies, the more natural therapies, and certainly qigong, I would say for anyone on the piano, could be helpful. But those therapies can then help them better tolerate the side effects of the chemotherapy and radiation.
And talk about that a little bit more, because when we see patients going through chemo radiation, I mean, it's so hard on the body. What can some of these other options do versus someone who just goes down that one road?
What we're seeing in certain cases, like I mentioned, there is synergistic activity for qigong and immune function. We're seeing synergistic activity with the chemo and the qigong. Also, there are studies showing that certain botanicals, like curcumin, have synergistic activity with particular chemotherapy agents, like Gemzar and 5-FU or fluorouracil. Those chemotherapies, they're actually finding greater effectiveness for people who add curcumin. So the curcumin and the 5-FU or Gemzar together work better than either one by themselves. So it's important to know that sometimes there's synergistic activities with bringing them together. We also see patients who have less neuropathy, adding things like L-glutamine, and I tend to use it in pulse doses. There are also certain other nutrients and things that help reduce the side effects of chemotherapy and radiation. And it doesn't have to be just supplements. As I mentioned, qigong has a great track record of reducing nausea, vomiting, the fatigue that's often associated with cancer. There are also things like the C-band bracelet, which puts pressure on pericardium 6, which is 3 finger breadths below the crease on the wrist between the two tendons there. And that's been researched and shown to help reduce the side effects of nausea, whether it's from chemotherapy or pregnancy, or also from motion sickness. So there are things that people can do that can make their journey through their cancer treatment much easier. And not guaranteed that it'll be completely smooth, but many of the patients I work with have had treatment other places before and then come to work where they have, again, that whole keyboard available to them, and they have a much easier ride. Not necessarily completely smooth, but much easier.